Good morning, teacher and classmates. My name is Madeline Mejia, and today I'm going to talk about canagliflozin and renal outcomes in type 2 diabetes and nephropathy. Definition. Type 2 diabetes mellitus is the leading cause of kidney failure. The most critical long-term complication of type 2 diabetes is nephropathy. Many drugs lead to the kidney failure. In cardiovascular trials of inhibitors of sodium glucose cotransporter 2, exploratory results have suggested that such drugs may improve renal outcomes in patients with type 2 diabetes.
Hello guys, let's begin with our topic, SGLT2 inhibitors. SGLT2 inhibitors act on the proximal convoluted tubule of the nephron. Let's say what happens in PCT. The microscopic structure contain PCT lumen, epithelial cell of PCT and blood vessel. SGLT2 proteins located in the renal tubules of the kidneys which are responsible for reabsorbing sodium glucose back into the blood. SGLT2 inhibitors inhibit SGLT2 proteins. As a result, more glucose is excreted in the urine. SGLT2 inhibitors contains canagliflozin, empagliflozin, dapagliflozin, which are responsible for inhibit SGLT2 proteins. As a result, more glucose is excreted in the urine. And this medicine's used to lower high blood glucose levels in people with type 2 diabetes. SGLT2 inhibitors used in type 2 diabetes. They are not approved as diuretics. Side effects of these drugs can cause severe renal, or liver, diseases.
Applications in medicine. The canagliflozin is an inhibitor of sodium glucose cotransporter 2. It reduces the blood glucose levels in patients with type 2 diabetes. Canagliflozin may be an effective treatment option for renal and cardiovascular protection in patients with type 2 diabetes with chronic kidney disease. Pros and cons. Pros: lower blood glucose episodes. Lower risk of kidney failure and cardiovascular events. Cons: it may cause hypotension that causes symptoms such as dizziness, lightheadedness, and fainting. Canagliflozin may cause high potassium levels in the blood.
Type 2 diabetes mellitus is the leading cause of kidney failure worldwide. Exploratory findings from trials of sodium glucose cotransporter 2 inhibitors evaluating cardiovascular outcomes have suggested potential renal benefits, but uncertainty persists. In this multi-center double-blind randomized trial, 4,401 patients with type 2 diabetes and albuminuric chronic kidney disease treated with renin-angiotensin system blockade were randomized to 100 milligrams of the SGLT2 inhibitor canagliflozin per day or placebo. The primary outcome was a composite of end-stage kidney disease, a doubling of the serum creatinine level, or death from renal or cardiovascular causes. A pre-specified safety outcome was the rate of lower limb amputation and fractures. The trial was stopped early after a planned interim analysis because pre-specified efficacy criteria had been achieved. At a median of 2.62 years of follow-up, the event rate of the primary outcome was significantly lower in the canagliflozin group than in the placebo group. The relative risk of the primary outcome was 30% lower in the canagliflozin group. There was no significant difference in the rate of lower limb amputation or fractures. The authors conclude that in patients with type 2 diabetes and kidney disease, the risk of kidney failure and cardiovascular events was lower with canagliflozin than with placebo.
Applications in Ecuador. The use of canagliflozin in Ecuador has not been reported yet, but some doctors recommend the use of this drug due to its benefits. Also, some of them are against this drug because of the increase in the risk of non-traumatic amputation. In conclusion, the use of canagliflozin may improve renal outcomes, and it can help with weight loss. The correct use of this drug may reduce the risk of kidney failure that can lead to nephropathy. Thank you.